Okay, so here's something that might actually surprise you. A really significant number of people who have common STIs,
Mm.
they don't experience any symptoms,
Mm.
like none at all. Think about that. You could have an infection right now and be completely unaware.
Yeah, absolutely. It's kind of wild when you think about it that way.
It is, and that's a huge reason why, really, like understanding these infections is
Yeah.
so important, for being proactive about our health.
Absolutely. And that lack of obvious signs, that's exactly why this deep dive is, well, so necessary, I think.
Right.
We're going to be focusing today on sexually transmitted infections, or STIs, and we're drawing from some key learning objectives here.
Okay.
We'll break down the main types. You've got bacterial, viral, and parasitic. And we'll explore specific examples in each group.
Right. So we'll be looking at the bacterial players, yeah, like chlamydia, gonorrhea, and syphilis.
Exactly.
Then we'll move on to the viral ones, HPV, that's human papillomavirus, then HSV or herpes simplex virus, HIV, which, if it's not treated, can lead to AIDS,
That's the one.
and hepatitis B. And finally, we'll cover the parasitic one, trichomoniasis.
You got it.
And the goal here, just to be clear, isn't to drown you in complicated medical terms.
No, definitely not.
It's more about providing clear, understandable information so you feel well-informed, maybe empowered about your health, no matter what your background is.
Precisely. And getting those categories down, bacterial, viral, parasitic, it's really fundamental.
How so?
Well, it influences how these infections act in the body and, crucially, how we actually go about treating them.
Oh, okay. Makes sense.
So, like we said, the bacterial ones, chlamydia, gonorrhea, syphilis, viral, HPV, HSV, HIV, and Hep B.
Got it.
And trichomoniasis is our parasitic example.
Okay.
What's also worth pointing out early on is that some viral STIs, they can have pretty significant long-term health effects if they aren't managed properly.
Like what?
Well, for instance, certain types of HPV can, in some cases, lead to cervical cancer.
Right, I've heard that link.
Yeah. And untreated HIV, that can progress to AIDS, which is a much more severe state where the immune system is really compromised.
Okay, so let's dive into the specifics then.
Yeah.
What might someone actually experience if they do have one of these? But keeping in mind, like you said, often there might be nothing.
Exactly. Nothing at all sometimes. Chlamydia and gonorrhea, they're often called silent infections for that very reason.
Silent, okay.
Because many, many people have them without any noticeable symptoms, especially at first. I mean, some studies suggest up to 70% of women with chlamydia might not have initial symptoms.
Wow, 70%, that's huge.
It is. Now, when symptoms do show up, they can include things like unusual discharge, maybe a burning feeling or pain when you pee. That's called dysuria.
Right.
And sometimes pelvic pain.
Right. And what about syphilis? You said that was bacterial too.
Yes, syphilis is bacterial, but it behaves a bit differently. It develops in these distinct stages.
Stages?
Yeah. The primary stage, that's usually marked by a painless sore. It's called a chancre.
Painless.
Okay.
So you might not even notice it then.
You might not, or you might dismiss it. If that isn't treated, it can progress to the secondary stage.
And what happens then?
That's where you might see a rash, characteristically on the palms of the hands and the soles of the feet. Often comes with a fever, too.
Okay, hands and feet, that's specific.
It is. And then, if it's still untreated, you can get to the tertiary stage, which is the most serious. That can cause severe neurological problems, cardiovascular damage, really serious stuff.
Okay, that really does highlight why testing is so important, even if you feel fine.
Absolutely critical.
So what about the others? HPV, HSV, HIV, and that parasitic one, trichomoniasis. How do they usually show up?
Right, so HPV is quite interesting. It often presents with genital warts, visible growths.
Yeah.
But very frequently, it's also asymptomatic. You wouldn't know you have it. The main worry with certain HPV types is that strong link to cervical cancer we mentioned.
Right, but there's a vaccine for that now, isn't there?
Yes, that's a really important point. The HPV vaccine has dramatically reduced rates of cervical cancer and genital warts in populations that get vaccinated. Huge public health success.
Good to know. Okay, what about herpes, HSV?
Herpes, caused by the HSV virus, typically involves these painful blisters or ulcers.
Wow.
Yeah, they can be quite uncomfortable, often accompanied by fever and maybe swollen lymph nodes during the initial outbreak.
Okay, and HIV?
HIV can initially cause flu-like symptoms, fever, fatigue, sore throat, muscle aches, things that are really easy to mistake for just the flu or another bug.
Yeah, very nonspecific.
Exactly. The crucial thing about HIV is that over time it gradually attacks and weakens the immune system.
Gotcha. And the last one, trichomoniasis.
Trichomoniasis, the parasitic one, often has more specific symptoms, especially in women. Things like a frothy yellow-green vaginal discharge, sometimes a noticeable fishy odor, and itching or irritation in the genital area.
Okay, that sounds more noticeable, maybe.
It can be, yeah, though men often have milder or no symptoms.
Right. So being aware of these potential signs is like one piece of the puzzle. What about the other side? What factors might put someone at a higher risk of even getting an STI?
That's a key question. Several factors definitely increase the likelihood. Having multiple sexual partners is a big one.
Okay.
Engaging in unprotected sex, not consistently using barrier methods like condoms, that's probably the most significant risk factor overall.
Makes sense?
Starting sexual activity at a younger age can also increase the cumulative risk over a lifetime.
Right.
Having a history of previous STIs suggests, maybe behaviors or circumstances that put you at higher risk and you might be more susceptible again.
Okay.
And lastly, individuals with weakened immune systems, maybe due to other health conditions or medications, they might be more vulnerable.
Right. And how exactly do these things spread? What are the main ways they transmit?
Okay, so the primary routes for almost all STIs are through vaginal, anal, and oral sex. That's the main way they pass from person to person.
Okay, sexual contact.
Exactly. But some STIs have other ways too. For instance, some can be passed from a mother to her baby during pregnancy, during childbirth, or sometimes through breastfeeding. We call that vertical transmission.
Ah, mother to child. Okay.
Yep. And also, HIV and hepatitis B specifically can be transmitted through direct contact with infected blood, like sharing needles, for example.
Right, blood-borne transmission. Okay, so let's say someone suspects they might have an STI, or maybe they don't have symptoms, but they're concerned because of some risk factors we just talked about. What kind of tests are out there? How do you actually find out?
Good question. We actually have very effective diagnostic tools these days. For chlamydia and gonorrhea, the gold standard is something called nucleic acid amplification testing. NATAs, for short.
NATAs. Okay, what are those?
They're super sensitive tests. They can detect even tiny amounts of the bacteria's genetic material, like its DNA or RNA, from a urine sample or a swab, makes them very reliable.
Wow, okay. That sounds pretty advanced.
It is. For syphilis and HIV, we often use serologic tests.
Serologic, meaning blood tests.
Usually, yes. These tests look for your body's immune response to the infection, specifically the antibodies your body produces to fight it, or sometimes antigens, which are parts of the virus itself.
Okay.
So for syphilis, common tests are called RPR and VDRL. For HIV, we use tests that look for both HIV antibodies and antigens. These antigen-antibody tests can detect infection earlier than antibody-only tests.
Got it. What about herpes, those blisters you mentioned?
For herpes, if there are active blisters or ulcers, a doctor can take a sample directly from the sore and send it for a viral culture or a PCR test, which also looks for the virus's genetic material.
Okay, testing the sore itself.
Exactly. And for HPV in women, pap smears are really crucial screening tools. They look for abnormal cell changes on the cervix that could be caused by HPV and might become cancer if not watched or treated. Sometimes they also test directly for high-risk HPV types.
Right, the pap smear. Very important.
For trichomoniasis, that parasitic one, it's usually diagnosed with something called a wet mount. Yeah, a sample of vaginal fluid is taken, put on a slide with some saline, and looked at under a microscope. You can often see the little parasites moving around.
Wow, okay. You can actually see them.
You can. And finally, for hepatitis B, screening involves a hepatitis panel, which is a series of blood tests looking for different markers of the virus antigens and antibodies to see if you have a current infection, a past infection, or immunity from vaccination.
Okay, so it sounds like there's a specific test or a set of tests for pretty much each of these infections.
That's right. Very targeted diagnostics.
That's definitely reassuring.
Yeah.
But what happens if these things don't get caught, if they go untreated? What are the potential, long-term consequences?
Yeah, that's where things can get quite serious, unfortunately. Untreated chlamydia and gonorrhea, for example, can travel up the reproductive tract in women and cause pelvic inflammatory disease, or PID.
PID, I've heard of that. What does it do?
PID is a serious infection of the uterus, fallopian tubes, and ovaries. It can cause chronic pelvic pain, really debilitating pain sometimes. And critically, it can damage the fallopian tubes and lead to infertility or ectopic pregnancy, which is life-threatening. And men aren't totally off the hook either. It can cause epididymitis, inflammation in the testicles, which can also affect fertility.
Wow, okay. Infertility is a major consequence.
Huge. Untreated syphilis, as we hinted at with the stages, can have devastating effects later on. Neurosyphilis, where it affects the brain and nervous system,
Okay.
cardiovascular problems like damage to the aorta, and in advanced stages, years down the line, it can even cause death.
Gosh, that's incredibly serious.
It is. And as we discussed, untreated high-risk HPV can progress to various cancers. Cervical cancer is the most well-known, but also penile, anal, throat, and vaginal or vulvar cancers.
Right, the cancer risk.
Yeah. With herpes, if a woman has an active outbreak during childbirth, there's a risk of passing the virus to the baby. Neonatal herpes is rare, but it can be incredibly dangerous for the newborn.
Oh, wow. What?
Untreated HIV, as we know, progresses to AIDS, acquired immunodeficiency syndrome. That's when the immune system is so weakened that the body becomes highly vulnerable to all sorts of opportunistic infections and cancers that a healthy immune system would normally fight off.
Right, leading to severe illness.
Exactly. And even trichomoniasis, which sometimes people think of as less severe, if untreated, it can lead to complications during pregnancy, like premature birth. And it's also been linked to an increased risk of getting or transmitting HIV.
So really, none of these should be ignored. The potential complications are pretty significant across the board.
Absolutely. Early detection and treatment are key to preventing these long-term problems.
Okay, so that leads perfectly to the next question. Once an STI is diagnosed, what can be done? What are the treatments?
Well, the good news here is that many STIs are effectively treatable and some are completely curable.
Okay, that's good to hear.
Bacterial STIs, chlamydia, gonorrhea, syphilis are typically treated and cured with antibiotics.
Right, antibiotics for bacteria.
Exactly. Think of it like antibiotics are the specific key for the bacterial lock. They won't work on viruses.
Makes sense.
So for chlamydia, common antibiotics are azithromycin, often just a single dose, or doxycycline, usually taken for a week.
Okay.
Gonorrhea treatment has gotten a bit trickier because of antibiotic resistance, but it's usually treated with an injection of ceftriaxone, sometimes combined with oral doxycycline or azithromycin.
Right, resistance is a growing issue, isn't it?
It is, unfortunately,
Mhm.
which makes completing the full course of treatment so important. For syphilis, the standard treatment, especially in the early stages, is an injection of penicillin G.
Penicillin, okay, the classic.
Yep, still highly effective for syphilis. Now, for viral STIs, it's a bit different. We don't have cures for all of them in the same way we can cure bacterial infections.
Okay, so what do we do for viruses?
We have antiviral medications that can manage the symptoms, reduce the frequency and severity of outbreaks, and significantly lower the risk of transmitting the virus to others.
Okay, so management rather than cure for some.
For some, yes, like for herpes, antiviral drugs like acyclovir, valacyclovir, or famciclovir can be used to treat outbreaks when they happen, or sometimes taken daily to suppress outbreaks and reduce transmission.
Got it.
For HIV, the development of antiretroviral therapy, or ART, has been revolutionary.
Right, yeah.
It's usually a combination of several medications taken daily. ART doesn't cure HIV, but it suppresses the virus to undetectable levels in the blood.
Undetectable, what does that mean exactly?
It means the amount of virus is so low it can't be measured by standard tests. And crucially, when the virus is undetectable, it cannot be transmitted sexually to a partner. This is often summarized as UU, undetectable equals untransmittable.
Wow, that's huge.
It's completely changed the landscape of HIV.
Yeah.
People on effective ART can live long, healthy lives and don't have to worry about transmitting the virus sexually.
That's amazing progress.
It really is. And finally, for trichomoniasis, the parasitic infection, it is curable with specific anti-parasitic drugs, most commonly metronidazole or tinidazole, usually taken as pills.
Okay, so that one's curable too.
Yes. Important for both the infected person and their sexual partners to get treated to avoid reinfection.
Right. Treating partners makes sense. And of course, prevention is always, the best strategy if possible. What are the key ways to prevent getting or spreading STIs in the first place?
Absolutely. Prevention is paramount. Practicing safe sex is number one. That means consistent and correct use of barrier methods, like condoms for vaginal, anal, or oral sex.
Condoms.
The mainstay. They are highly effective when used properly every time. Getting vaccinated is another key strategy, specifically the HPV vaccine, like Gardasil.
I mentioned that earlier.
Yeah, it's highly effective in preventing infection with the HPV types that cause most cervical cancers and genital warts. It's recommended for adolescents, but also available for young adults.
Good. What else?
Regular STI screenings are crucial, especially if you're sexually active, have multiple partners, or fall into other risk groups. Talk to your doctor about what screening schedule is right for you. Finding infections early, especially the silent ones, is key.
Okay, routine screening.
Partner notification is also vital. If you're diagnosed with an STI, it's really important to inform your recent sexual partners so they can get tested and treated too. This helps stop the spread.
That can be a tough conversation, but necessary.
It can be, but it's so important for public health and for the health of the people you care about. And finally, just education. Understanding the risks, knowing how STIs are transmitted, knowing the prevention methods, all of this empowers you to make informed decisions about your sexual health.
Knowledge is power, basically.
Exactly.
So we've covered a ton of really important ground now. I know we have this master cheat sheet that kind of boils down the key facts for each STI. Maybe we can just quickly run through that to help lock in the main points.
Definitely. A quick review can be really helpful. Let's look at the cheat sheet.
Okay.
So chlamydia causes bacterial. Symptoms often absent but can include discharge. Screening test is the NAT. Typical treatment, azithromycin or doxycycline.
Got it. Next.
Gonorrhea, also bacterial. Symptoms can include painful urination, discharge. Screening is also innate. Treatment usually involves ceftriaxone, that injection, often plus an oral antibiotic like doxycycline.
Vocabulous.
Bacterial again. Progresses in stages, painless sore, then maybe a rash, then potential serious long-term issues. Screening uses those blood tests, RPR or VDRL. Treatment is penicillin G.
Right. Moving to viral. HPV.
Viral often presents with warts, but frequently asymptomatic. Screening in women uses pap smears and maybe HPV testing. No cure for the virus itself, but there's vaccination for prevention and treatments for the warts or cell changes it causes.
Okay. Herpes.
That's the HSV virus. Causes painful blisters or ulcers. Diagnosed typically by looking at the sores and doing a viral culture or PCR test from a sample. Treated with antiviral medications like acyclovir to manage outbreaks.
Got it. HIV.
Virus. Initial flu-like symptoms possible, then progresses to weaken the immune system if untreated. Diagnosed with HIV antibody-antigen blood tests. Managed very effectively long-term with ART, antiretroviral therapy. Remember, UU.
Right. UU. Huge. And the last one.
Trichomoniasis. That's the parasite.
Yeah.
Characterized often by that frothy discharge and odor, especially in women. Diagnosed usually with a wet mount looking under the microscope. And it is curable with metronidazole or tinidazole.
Perfect. That cheat sheet really does crystallize it nicely. So as we start to wrap up this this really important deep dive, what would you say are the absolute key takeaways, the things you really want our listeners to hold on to?
Okay. I think the most critical points are, first, just recognizing the sheer variety of STIs, bacterial, viral, parasitic, they're all different. Second, and maybe most importantly, remembering that many, many STIs can be present without any obvious signs or symptoms.
The silent nature.
Exactly. That silence really underscores the need to be proactive. Get regular screenings if you're sexually active, even if you feel perfectly fine. Talk to your doctor.
Yeah.
Third, know that effective treatments are available for many STIs, and even for those without a cure, like HIV or herpes, there are excellent ways to manage them and prevent transmission.
Good point.
And finally, remember that prevention works. Using condoms, getting vaccinated for HPV, making informed choices, these are concrete steps you can take to protect your own health and the health of your partners. It's really about informed decisions and responsible practices.
Well said. So maybe a final thought to leave everyone with. Considering how often these infections, as you said, can fly under the radar, can be silent, what broader, maybe proactive steps do you think could really make a difference? Not just for individuals, but for improving public health outcomes related to STIs overall.
That's a great question to ponder.
Yeah, it definitely gives you something to think about, doesn't it, on a larger scale?